Hello everyone, I'm Fiona. I'm the Specialist Oncology Dietitian working in South Tyneside and Sunderland NHS Foundation Trust. So now we're talking about living with and beyond cancer. So firstly, after your treatment, some of the focus of our nutrition changes at this time. For most people, the side effects may be settled and then you can eat and drink normally. For others, certain side effects may last a little bit longer and then you may need to continue on the nourishing diet. Nutrition remains really important within this period. However, our recommendations are switching from having a nourishing diet back to a healthy, balanced diet when you manage eating and drinking a little bit better. What is a healthy lifestyle? Including a healthy, balanced diet along with physical activity. This will mainly for maintain your healthy weight and maintain your muscle mass. Maintaining your healthy weight and muscle mass can overall increase your quality of life and reduce the risk of developing another cancer. What does it mean by healthy balanced diet? So if you can looking at this Eat Well guide, there are a lot of different food groups which you should be including in your daily diet. So for example, the fruit and vegetables, we recommended to have at least 5 portions of fruit and vegetables per day. So what classifies as 1 portion? So 80 grams of fruit or vegetables will be a portion. So 80 grams could be 1 medium apple, 1 medium banana, about 3 tablespoonfuls of, for example, broccoli, and a dessert bowl full of salad if it's raw. Fruit and vegetables, the portions could come from fresh, frozen or canned. So the next bit, which is really important, is a starchy carbohydrates. So what does it mean by starchy carbohydrates? We also call it long-acting carbohydrates. So for example, your wholemeal bread, your sweet potatoes, and some of the potatoes or pasta, they help to stabilize your blood sugar and they give you fuel for energy to do work, and then they include a lot of more fiber to help you to feel full longer. We should also include protein sources into your diet at each meal. So what do I mean by protein sources? Protein sources are meat, fish, eggs. Recommended that using lean meat will be better so that we don't need to have a lot of fat in our diet. I would recommend it to maybe maintain in a palm size when you are having a meat. Beans and pulses or other vegetable protein are good alternative sources as well, which they are often lower in fat and higher in fiber. We should not having too much fat in our diet, but having some fat in our diet are essential for our body to function as well. So there are 2 main types of fat, which are unsaturated fat, which you can find from vegetable oil, avocado, oily fish, or saturated fat, which you can find in butter, some meat, biscuits or cakes. We should try to get the fat in our diet from unsaturated fat sources because it can help us to prevent development of high cholesterol level. Lastly, apart from healthy balanced diet, being physical active can also help you to build a muscle strength and maintain a healthy weight. It is recommended 30 minutes of moderate exercise daily would be sufficient. For people with advanced cancer, the best supportive cares are often recommended for them to improve their quality of life. Some of them may still have a palliative treatment, so for example chemotherapy and radiotherapy for their symptoms control, and they often require an additional dietetic support. Our main focus is to achieve a quality of life and encourage the enjoyment of food. What we can do is we can often provide some support to improve your strength and energy levels to do the things that you wanted. And if you would like a little bit more information, you can speak to your specialist nurses, your GP, or your dietitian for further information. Thank you.